I am glad that the Strengthening Community Care Act has been included in this bill. I am disappointed, however, that language applying the Hyde Amendment to the Community Health Center Fund and the National Health Service Corps is included in it. That is why I'm introducing this amendment to strike the language including these provisions from this bill. The Hyde Amendment, which many on this committee are familiar with, has been used since 1976 to block federal Medicaid funding for abortion services and has been extended to other federal programs. Every woman in the United States of America should be able to access the full range of reproductive health care services and to make her own decisions about her reproductive health care with autonomy and dignity. The Hyde Amendment stands in the way of this ability and of the fundamental equality of those whose care falls under it. This is really an issue of equality, fairness, and justice. And it affects real people, people that we all represent. In my home state of Texas, which has effectively eliminated access to abortion care, we see vividly the effects that provisions like this one can have for patients denied access to care. I met recently with a Texas woman who was denied abortion care after she experienced preterm, pre-labor rupture of membranes at 18 weeks of pregnancy. She was denied abortion care under Texas law. 3 days later, she showed signs of an infection and was diagnosed with sepsis, which my physician colleagues here know is a life-threatening condition. Although doctors then performed an emergency abortion only once her life was clearly threatened, she spent the next 3 days in the ICU fighting for her life. She ultimately survived, but the infection caused permanent damage, compromising her ability to have children in the future. This is not an isolated story. There are a lot of stories like this that I'm hearing from patients and providers, their doctors in my district in Houston, who cannot meet the standard of care for their patients, and they cannot meet them under these kinds of constraints. And this story, as I mentioned, it isn't isolated. This patient and 12 others are suing the state of Texas over this vague law that prevents access to essential abortion care in circumstances like this, circumstances like what we may see here. And we have to ask the question, what happens to poor women in this situation? What happens to the women who are relying on Medicare? What happens to women who are getting their care at community health centers? As I said earlier, every woman in this country should be able to access the full range of reproductive health care services and to make her own decisions with autonomy and dignity. The Hyde Amendment, as I said, stands in the way of this. And that's why I hope that all of my colleagues here will join me by voting for this amendment and removing the Hyde Amendment from this important and good legislation.